Right now, as I preempted early on Wednesday, President Cyril Ramaphosa extended the national state of disaster to the 15th of December. But during his address, the president announced that because of recent progress and stability, the sale of alcohol would in fact be allowed at weekends with normal trading hours. Now, the president also said that international travel could resume, but what does this mean for the country's healthcare system, particularly seeing that cases in some provinces are still on the rise and, of course, that some European countries are seeing a resurgence? What will this mean for our trauma units when the festive season usually sees an increase in alcohol-related trauma cases? Now, joining us to add to this discussion, perhaps what it means for public healthcare system at large is public health specialist Dr. Lehlohonolo Majake. Well, Dr. Majake, a very good morning. Thanks for joining us here on Weekend Dawn. I mean, just before we get into the specifics about what we can preempt ahead of the festive season, what does the current healthcare system look like in South Africa under COVID-19 as we make our way into December?
Okay. Good morning all. So the current healthcare system is a system that has been severely burdened with COVID-19 when it had already started on quite a low base. I think if you look at various documents such as your Human Resources for Health and also just looking at your various documents like your NSDA, we're all quite aware of the challenges that we've had in the South African health system. And I think while certainly there's been an increase in infrastructure, there still remains quite a big gap in terms of having your human resource, your nurses, adequate doctors, and just general access to healthcare, particularly in the rural areas. And there still certainly is quite a divide between those who can afford and those who can't from a medical aid perspective. So when you look at the public health system right now, I would say that yes, absolutely, it has had to actually have additional burdens when it already had its own challenges. However, there were several things that were implemented, as you've seen, for example, in Gauteng, there was Nasrec and other additional infrastructure that was created to actually manage the pandemic when we were not sure what level it would impact the country. And those were actually not really utilized fully. So with regard to being able to manage COVID-19, I think all the infrastructure was in place. But this has basically amplified the fact that we need to really go back and look at how we can actually reinforce our healthcare system in general, particularly on primary healthcare level.
So on that note, Dr. Lehlohonolo, I mean, we're looking at the public healthcare system, particularly as we enter the festive season. I mean, you've mentioned some of the infrastructural support systems that have been put in place to mitigate against some of the challenges that COVID-19 has presented. But when you look at access to healthcare, affordability, as you also mentioned, as some of the other factors that impacted at large, I mean, what are we preempting going into the festive season with the resumption of alcohol on weekends as well?
So, with the consumption of alcohol, we do know historically that it does tend to increase various traumas. It certainly also does increase various other social pathologies like your gender-based violence and your child violence. And I think we are preempting, obviously, we've seen the reduction in accidents when we reduced the sale of alcohol. So these are the things that we can preempt, which are pretty much the behavioral anomalies that actually take place within this festive period when alcohol is actually involved.
I'm looking at the reopening of international travel as well. I mean, we were just looking at some of the stats coming through from Tourism South Africa, where we anticipate about 10 million foreigners to hit the shores during the festive period. I mean, added on to what is currently happening internationally in Europe with the resurgence of infections, I mean, how is this ultimately then also going to impact South Africa's rate of infections, deaths, and also, the number of instances that we can expect going forward?
So, one thing about COVID-19 is we keep using the term going back to normal, and the reality is we can never really go back to normal. I think what we need to do is to try and modify how we practice things to allow various sectors that actually impact on health to continue. When we talk about health as experts, public health medicine experts, we talk about health in the context of social determinants of health. And in that, we include the economy, we include education, access to health, and just your general environment and your human development index of an individual. So with regards to increasing trade and tourism, that is pretty much also a factor that highly impacts on the health and the economy. When you've got money and you can actually work, you can afford things better, you can live healthy, you can feed your family. So one would certainly advocate for having an increase in economic activity in the country. I think what is important is just as with any other ailments, when we had a problem with HIV and it was quite a pandemic, what we did then is we looked at, your ABCs: abstain, be faithful, condomize. When we had Ebola as well, in certain parts of Africa, we looked at hand hygiene. You're having areas that have hydrochlorous acid, where you can frequently wash hands, avoid funerals, etc. So likewise with COVID-19, I think the measures that were taken were absolutely spot on to ensure that we understand the virus, because it was a novel virus. Most people didn't understand it, know what works, what doesn't work. And we need to then educate and reinforce behavioral tendencies and practices that will mitigate additional spread. But unfortunately, we cannot continue being in a bubble. The country has to open. We need to see economic activity. I think we've seen the stats in terms of unemployment. Already we were on quite a low base generally with our GDP. So we need to have ways in which we educate the public, and that's where health promotion comes in.
And I think it's also just perhaps also hone in on some of the hot spots that have also resurfaced. We are seeing in places such as the Eastern Cape, even Cape Town for that matter, which obviously has many people, worried about how this is going to impact when international travel is resumed. So when we look at those factors, and also just the number of cases and deaths that have occurred in the country, over 20,000 deaths to date, 740,000 cases plus or minus of COVID-19 infections in South Africa. I mean, looking at the introduction of this possible new vaccine that's also, been touted as a means to stabilize what is currently transpiring the world over. How do you think this is also ultimately going to impact the dynamics the world over at large?
So the first thing I actually want to say as well is I heard you talk about your number of deaths, and what we would look at is obviously the case fatality rate. And in South Africa, what we've noticed is the case fatality rate was not actually as great as we saw generally in other parts of the world. And I think that's also one thing that will then gain confidence or boost confidence in some of the decisions that are taken to then open up certain practices that will then have international trade and travel. With regards to the vaccine, of course, once we have a drug that will actually help to prevent additional infections, it certainly will help with, I think, a more calmer approach in terms of how the globe interacts. I mean, we are living in a globalization period where different parts of the components have to interact, where 2.4 million people interact over 24 hours with travel. So what I foresee is certainly, I think there'll be more calm. I think we're learning more about the virus as we go. And that's also not only just with acute phase infections, but also with chronic phase and how to mitigate and how to manage various things that occur afterwards. I think what is important, though, is we should not really forget the basics. And that is wearing your mask, hand hygiene, being socially responsible. And I think what is important as well is we need to really start having on our agenda at all times the conversation of health for all and the person next to you. So we need to really understand that what we do and the practices that we actually engage in, be cognizant of the impact they have on the person next to us.
All right, Dr. Lehlohonolo Majake, medical doctor and public health medicine specialist, just taking us through what the new lockdown regulations, as announced by the president this past Wednesday, will actually entail, particularly for the healthcare sector going into the festive season, as well as the threat of a resurgence of COVID-19 cases at the back of a potential vaccine surfacing.